This conference will now be recorded.
Welcome to our fourth monthly webinar. This month, we're discussing autoimmunity. My name is Brenda. I'm the Administrative Assistant for FitLogic Functional Medicine. We're recording this webinar and we'll share it via email to those who have registered. It will also be available on our website under the Resources tab. We have two speakers today. Our first today is Cecily Eckert, functional nutritionist with expertise in gut health and autoimmunity. She has extensive training and personal experience with autoimmunity and is on a mission to help as many people as she can. Traditional medicine did not work for her, so she sought out education on her own and found a way to heal her own chronic disease without pharmaceutical drugs and making diet and lifestyle changes. She is very excited to discuss autoimmunity with you today and help you gain some insight into the complexity of it. Our second speaker is Megan, owner and founder of FitLogic Functional Medicine, nurse practitioner, and hormone expert. Megan has extensive postgraduate training in preventative and functional medicine and is certified in advanced bioidentical hormone replacement therapy, heart math, and mind-body medicine, and anti-aging medicine. She has also had personal experience with a system that did not work for her and is an avid out-of-the-box thinker. She will discuss one more thing that has been well researched and often works quite well to improve symptoms and quality of life, but is not taught in schools and is rarely used. A bit of a gem for some. We will take questions for 10 minutes after the webinar. However, if you have a question during the presentation, you can type them in the chat and we will answer them at the end. Okay, let's get started.
Hi, everybody. I'm Cecily. Brenda said autoimmune expert, I think, and I would say that autoimmune expert chose me. For those of you that don't know me, I actually do have a chronic digestive issue that's also an autoimmune disease. I have inflammatory bowel disease. So my expertise is both professional and personal. And so today we're going to talk about immune dysregulation and autoimmunity. So let's get started. So I'm just going to start off with a couple of facts. Autoimmune disease is actually pretty much like a raging wildfire at this point, in my opinion. We are seeing massive increases worldwide of incidences of autoimmune disease, and it's not always explained by genetics. And we're going to kind of get into that in just a little bit. So not only are they rising, but they're occurring outside of what would have conventionally been known as the age range at which we would normally have seen them previously. So we're seeing them much younger or at different times in people's lives is what we had previously been used to seeing. And then also where they were less common as well, just around the world. And there are more than 100 different types of autoimmune diseases that have been named as autoimmune diseases. And I just going to put this in here as like, there will be more to follow. And that's because, putting more and more money into research to better understand autoimmunity. So things that we previously didn't even recognize as having an autoimmune component. Alzheimer's is a perfect example. We now know is autoimmune in nature. So we're going to see the number of autoimmune diseases climb over the coming decades for sure. About 40% of people that have one autoimmune disease have more than one autoimmune disease. And you're going to hear me say this probably again. They come in clusters. So a cluster can mean both that we find them in family systems, not always the same autoimmune disease necessarily as from, say, a parent to a child or between siblings, but autoimmunity in general. So that can be family clustering, but also each individual might have a cluster of autoimmune diseases. So where we find one, we kind of want to know, hey, where are the others if there are any? And that's a really tough question to answer. About 75% of people that are diagnosed with autoimmune disease happen to be women. I mean, I have some thoughts around why this might be. Are men less prone to go seek out, and seek out a doctor's appointment or try to kind of uncover what might be going on? That might have something to do with it. But right now, the statistic is that about 75% of people that have autoimmunity are women. So just to simplify autoimmunity, there's a lot of words here. We can simplify it even more. And that's just that, our immune system's job is to protect us against anything that comes into the body that's deemed foreign. And with autoimmunity, unfortunately, what happens is our immune cells that are supposed to protect us actually kind of turn on us, and they start targeting what we call self tissue. And that's where we just have it's like a communication breakdown, so to speak. And there's lots and lots of reasons why these mechanisms in the immune system fail. In fact, too many to go over in this 1 hour webinar, but super exciting things, very, very interesting things that cause autoimmunity to pop up in somebody's life and cause our own immune system to kind of turn and tag our own tissues as foreign, and then mount an inflammatory response. And basically, there's not a single tissue in the entire body that's protected from having this happen, unfortunately. So there's two basic types of autoimmune disease. One is called systemic. The systemic autoimmune diseases are really the most negatively impactful for quality of life, getting people into remission. Systemic means that the immune system is targeting a protein that affects lots of different tissues throughout the body. A really good example is lupus. So we're talking about the immune system tagging DNA as foreign. And so literally every cell in the body has DNA. So, we'll find that lupus will pop up and be problematic across the entire body. And it's getting more and more common for doctors to kind of have, raise a red flag and say, okay, wait a minute, are we dealing with lupus? Because they come in with symptoms that are across the body as a whole. But still, we have a long way to go. So tissue-specific autoimmunity, so this is basic, this is literally where the immune system has tagged a tissue that is to a specific gland or organ. So a really good example, I have two of them that I want to talk about: pernicious anemia. So this is targeting something called intrinsic factor that is produced in the stomach that actually affects B12 production. So very specific, right? And then adult onset type 1 diabetes is where the immune system is actually attacking islet cells in the pancreas. So two basic forms, but one thing I want to point out is that, and it might even be on the next slide, but I'm going to stay here for just a second, is that the immune system goes through an incredible training camp, boot camp, basically, to ensure that our immune cells know what self tissue is. So when I say self tissue, I'm talking about every single tissue that's in our bodies that's not a bacteria or anything that comes in from outside of the body. So our immune system goes through rigorous boot camp training to be sure that the immune cells are never supposed to attack our own tissue. But again, we're seeing this happen with more and more frequency. So then the question becomes, why? Why are we seeing more of this, right? And how do we how do we address calming down that immune response and modulating that immune response? And we're going to go over some of those concepts here today. So I wanted to point out the two, so what I think about, we have this organ system, we have a whole host of tissues and organs inside the body that are part of the immune system, right? We've got the spleen, we've got the appendix, we've got the tonsils and the adenoids, which tonsils and adenoids are taken out all the time, right? It's very, very, very common before, children are even, 6 and 7 years old. A lot of children have already had their tonsils and adenoids taken out because they've been inflamed, and there's this recurring issue with inflammation in the tonsils and the adenoids. So the answer is to take them out. It's, there's not a lot of investigation into, well, what's causing that inflammation? So it's just an example of, we use a lot of blocking factors in our society and our medical system. And we use surgical procedures to try to help manage our immune function instead of doing kind of the deep dig to try to figure out what's causing the dysfunction to begin with. So we've got this whole organ system. We've got actual immune cells, which I actually took this picture from an amazing book that I'm going to tell you about at the end of the webinar. And I just love the graphic here. I just think it's bright and it's beautiful, and it makes the system seem really, invigorating and cool. So we've got a lot of players here that work together. The system as a whole is, honestly, it is incredibly complex. And, nature has designed something that really, really works well. And so we have to figure out, well, if we have a system that's designed to work so well, what causes the system to not work well in the end, where we end up with autoimmunity? And I'm just going to say really quickly, so these cells are made in the bone marrow, and then some of them are moved into the thymus, where that's where this training camp happens, where this boot camp happens, where literally inside the thymus, the immune cells are trained to understand very clearly the protein structure of self tissue versus understanding what is not intended to be in the body. So what would be deemed foreign, so that there is no mistake. So there's, no turning on ourselves on the host of these immune cells. And at the end of the boot camp, basically, if immune cells don't meet the criteria, they are told to basically self-destruct. So it's, they have to go on a suicide mission. So the system is set up to where these immune cells shouldn't make it through. But there's failures in the system over time. So symptoms of autoimmunity. This slide to me is kind of a crazy slide, because I could have just kept going on all these symptoms, because really, because there's, at least we know 100 different types of autoimmunity. Really, we need to know what the symptoms look like for each specific type of autoimmunity. And so that's why I think this is kind of a funny slide, because we might see, something that's not on here is, jaundice. That might be something that would come up with liver autoimmunity. Yes. And so not everything is on here, obviously, but these are kind of some of the ones that we hear a lot: fatigue, joint pain, skin-related issues. So, if you have hives, we need to be thinking about autoimmunity. If you're sensitive to chemicals, one of the things that has popped up for me with dealing with autoimmunity is I can remember as a kid loving to go, like when my mom would pump the gas, I love the smell of gasoline. And now it literally gives me a headache, and I can feel kind of like this sensation in my lungs. So if you're sensitive to chemicals, and maybe you always have been, but maybe it's gotten worse, or maybe you weren't and now you are, be thinking, what's causing me to, what's the cause of this increase in this symptom? Food reactions definitely can be autoimmune in nature. Swollen lymph nodes, muscle weakness and aches, weight loss or gain, loss of appetite and increase in appetite, hair loss. I mean, we've got a sensory sensitivity, I think, is another interesting one where, if you're sensitive to light or sound, this could be neurologic autoimmunity, and there's many neurological autoimmune issues. So the list could go on and on. What I want to talk about is a little more specific on the next slide. And that is what I would consider to be better red flags for autoimmune disease. Because what happens is we go in for a doctor's visit because we have a set of those symptoms on the previous slide. And, the doctors are basically scratching their heads going, well, I don't really know what's going on here. But, if they've got sensitive skin, if they've broken out in hives, well, let's give them some Benadryl, right? So the system is set up to give you something to reduce the symptom, not to understand the symptom. So these red flags, I think, are really, really important for anyone that's dealing with a certain set of symptoms that have gone unresolved. I think that it's important to begin thinking about, could this be autoimmune or immune system dysregulation? So the top ones are, just like I said, nothing has been resolved. So you have your chief complaints, and basically years have passed and you still have those chief complaints. Nothing is really working. You have some treatments that have helped, but then the symptoms return. So many autoimmune diseases they go from what we call a flare stage to remission. And I'm saying many because I am not an expert on every single autoimmune disease. So there may be an autoimmune disease out there that doesn't have this ebb and flow cycle that most autoimmune diseases have. So just going to throw that out there. So having symptoms resolve and then return and maybe even be cyclical in nature is a telltale sign of being in remission or or in a flare. Multiple adverse reactions to food or chemicals is a really, really big one. Numerous diagnoses and doctors in your medical history. Many autoimmune patients have sought out answers from multiple doctors, right? You go to the doctor, you don't get an answer. You go to another doctor, then you find another doctor. Your friend tells you about somebody else, you go see them. So a lot of times when people come into the clinic, we hear the story, I've been from doctor to doctor and I can't get resolution. And immediately my mind starts thinking, could this be a potential autoimmune issue? Large files of labs and countless bottles of supplements. And, I take a lot of supplements. That's true. But we're talking about, some people baskets and baskets full of supplements that maybe they've gone to see, when they've gone to see all these different practitioners, they're still taking lots and lots of things. And we love to have a lot of different lab work. We're not against lab work. It's just one of those signs. You can probably see this story unfolding where it's lots of different types of issues that have gone unresolved. I've been lots of different places, can't get the help, but I'm taking lots of things and I'm not seeing any improvement. The other thing that I want to point out is that sometimes people are actually diagnosed with something. They're given the name of the diagnosis, but no one ever says, okay, this is an autoimmune disease. And so, diabetes, inflammatory bowel disease. I wasn't told when I was diagnosed with inflammatory bowel disease, nobody ever said that this was autoimmune in nature. Psoriasis, arthritis, Crohn's disease, celiac disease. There's lots of different types of autoimmune diseases where someone is not actually told they have an autoimmune disease. And see, if you go back to kind of what I said earlier, which is for about 40% of people, and that statistic might even be higher. So let's just say about 40% of people that have one autoimmune disease have more than one. And this is really important. So if you've been sitting on a diagnosis but didn't know it was an autoimmune disease, whoever you're working with, after that, if they're not aware of the fact that that's an autoimmune disease, no one is searching for what other types of autoimmune diseases you might have as well. So it's missing information that's really important to help you get better. Okay, so autoimmune disease is basically what we call loss of self-tolerance. What causes loss of self-tolerance? Because when we talk about self-tissue, tolerance is our immune system's ability to tolerate self-tissue. When we lose the ability for our immune system to say, okay, that's not foreign, that's supposed to be in the body, we call it loss of self-tolerance. There are more things than I could list that cause this loss of self-tolerance. So I'm only going to focus on the ones that really I feel are the ones that we have the most opportunity to manipulate or change in your favor if you have autoimmune disease. So pollutants, yes, I know people are going to say I can't control the pollutants that are in the environment. That's true, but it's also about making sure that we can, detox. I use that word very loosely. So we can move those pollutants out of the body, the ones that are possible to get out of the body. Toxins. Toxins, I always say, be aware of the fact that toxins don't just come outside of the body. Toxins, a lot of toxins are created inside of our body. Every process that's happening in the body is creating some minute little, amount of toxin. Cellular death causes toxins, and we have cells turning over all the time. Trillions of bacteria reside in our digestive tract. Those populations are turning over all the time. So we have environmental pollutants and toxins, but we also have toxins that are created inside the body. Hormonal changes can cause immune dysregulation. Immune reactive dietary proteins. I wanted to put an entire 5 slides about immune reactivity dietary proteins in here, but for the sake of time, I pulled them all out. So I'm just going to say that the language of the immune system is protein structure. So just think about that for a minute. We can learn any language that we want, basically. The immune system speaks one language. They've learned to communicate and identify based off of protein structure. The really important thing to understand here is that when a toxin binds to a protein structure in the body, or when a pollutant binds to protein structure in the body, when we get an infection and from a virus and it binds to a protein in the body, the protein structure changes. So this is part of what happens with our immune system, with immune system dysregulation. But from a dietary perspective, it's interesting because lots and lots of people come in, they have food reactions, they want to know what's going on, they run tests, and most tests, I would go so far as to say about 99% of tests on the market that are testing for immune reactivity to dietary proteins are only testing raw foods. I think, honestly, out of all the people that I know in my life, I know one person that eats exclusively raw. So that test that you can buy direct to consumer for $99 or $199 is valuable to people that eat raw exclusively. So most of us are eating cooked or what we call modified foods. If we go back to the idea that the immune system thinks and speaks the language of protein structure, when something is raw, a carrot that is raw the protein structure looks different than that of a cooked carrot. So we can have immune reactions to dietary proteins just based off of the fact that if we don't break down our food properly, the immune system doesn't recognize that that's a carrot. It thinks, oh, that must be something that's not supposed to be here. This is how food reactions actually develop. Infections, stress response. So our stress response definitely plays a huge role in immune dysregulation. In fact, even though I'm a nutritionist and I have put massive amounts of energy into dietary modifications for myself to be able to manage my autoimmunity, stress is probably more important than diet. Because when we're stressed, we don't break down food as well. Our digestion slows. It has an impact. Stress has an impact on digestion. And many, many people that have autoimmune diseases will report that maybe not their initial trigger that triggered the onset of autoimmunity, but follow-up triggers are stress related. And so we can't leave out stress, but stress also creates chemicals that are problematic for the immune system as well. So we have, a battery of things that come into the body that causes immune dysregulation. And then over time, that causes what we call loss of self-tolerance. And then we produce antibodies to our own tissue. And then that can trigger 3 types of autoimmunity: silent, autoimmune reactivity, and autoimmune disease. What I want to say before we go to the next slide is that autoimmunity occurs when we have genetic makeup, and it's usually not going to be, people want to hunt for a one gene. This is not really going to be the case. It's going to be several genes that have mutations that get turned on by exposure to these types of things. And then the immune system gets triggered, and then our B cells make antibodies. And then we have a group of B cells called memory B cells that, so if we have a pollutant or a toxin that binds to, oh my gosh, okay, the large intestines. And so it changes the protein structure. So genetically I'm predisposed so now my immune cells have decided that they were going to attack my large intestines because that protein structure doesn't look quite right, because now there's this toxin that's attached to that protein structure. And now I'm going to be making memory B cells. So it's just this repetitive cycle that happens. The immune system isn't going to forget that foreign thing is in my body. So this is the basics of autoimmunity. So why does a diagnosis take so long? There's so many reasons why, but I'm going to try to focus on these stages. So stage 1 is called silent autoimmunity. So essentially what happens is when you go in and you have symptoms that, maybe a doctor is thinking might be autoimmune in nature, they're going to check for elevated antibodies. And usually they're just kind of checking for the ones that are systemic. So they're looking maybe more for lupus than anything else. Or rheumatoid arthritis is another really, really popular one. So you might have elevated antibodies, but you have no symptoms whatsoever, and you don't have any loss of tissue. So in this scenario, in silent autoimmunity, I can't think of a situation where this would happen in a regular conventional medical system. When we do our evaluations here at the clinic, we're asking questions that you may not know. We're trying to figure out, do we need to be looking at elevated antibodies? And there are antibodies that we look at regardless of what you say, thyroid antibodies for sure. And so the only scenario where stage 1, pops up is when you have somebody that has had a conversation with you that is starting to think that they might need to evaluate your antibodies. That's not going to happen in a 7-minute conversation with your doctor. So stage 1 silent autoimmunity it's a thing, but it is rarely identified because you're not talking about the symptoms associated with a specific disease. And, if they were to do some imaging, so you go to the ER, they're not going to see any tissue loss or tissue damage. Stage 2 is called autoimmune reactivity, where they're seeing elevated antibodies and you're talking about symptoms. So then maybe they send you for some imaging, but they don't see any tissue loss. Now, right here, these two, stage 1 and stage 2, are amazing opportunities to prevent true autoimmunity, which is tissue destruction. What I want everyone to understand is that, and like, let's use Hashimoto's as an example. So with Hashimoto's, you can have elevated antibodies, you have no symptoms whatsoever. And if you were to do imaging, you have no loss of tissue. Amazing opportunity to prevent the onset of full-blown Hashimoto's where you have tissue destruction. And there are absolute strategies to be able to prevent the onset of Hashimoto's. If you have elevated antibodies and you're coming in and you're talking to Megan or myself about things that sound like you might have thyroid-related issues, we're going to be looking at, and Megan is going to be doing a physical examination. She is going to be touching your thyroid tissue. And if she thinks that it's necessary, she's going to send you in for imaging so that we can understand if there is any tissue loss. Now, stage 3, actual autoimmune disease, is you've got elevated antibodies, you've got all the symptoms, and guess what? You have tissue destruction. So with the same example of Hashimoto's, we've got the issue becomes that you're literally losing the function of the thyroid. And every single cell in the body has a receptor for thyroid hormone. So it's a big, big deal. So basically, it takes a really long time to get a diagnosis because you might be sitting in stage 1 or 2 for 20 years. To complicate things further, a lot of tests are looking at antibody production. They're looking at, so they're not drilling down enough into more different types of immune cells to see what's going on at a more precise level of screening for the different types of immune cells. So standard lab test, just wanted you guys to see this. We've got total white blood cells, lymphocytes, monocytes. These things are very common to be run. Kind of the ones that I've circled there in red are much less common. And the reason that they're much less common is because these are very difficult to, almost impossible actually, unless you have an autoimmune disease, to get your insurance to run these. So you have an advantage of stepping outside of the insurance system to be able to get answers as to what's actually going on, why you feel the way you feel, and to better understand which part of your immune system or parts of the immune system are dysfunctional. And that helps us put together a plan to be able to bring things back into balance. So insurance is part of the problem. I put at the bottom, there's this amazing test. It's called Cyrex Labs Array 5. And it looks at 24 or 25 different types of it's basically antibodies produced against self-tissue. So it's a very in-depth look at autoimmunity. I wanted to give you guys, this is like, okay, so you get a diagnosis. What do you do after you get a diagnosis? So I'm going to using Hashimoto's again as kind of this example. It's kind of this level 1 is, okay, yep, you need to change diet, nutraceuticals, basically supplements, change your lifestyle, maybe talk about hormone replacement. Those things are all really great. And then, but when we know more information, when we have gathered, as much information as we possibly can, we can put together a much more personalized autoimmune treatment plan that includes things where we're looking at, not just lifestyle triggers and things like that, but, chemical exposure. We're going to be talking about cross-reactive pathogens. We're going to be talking about cross-reactive foods. We want to know, is blood sugar dysregulation playing a role here? So there's so much more to a personalized autoimmune plan than these typical things that we think of. And if we one of the biggest questions that I ask people, and many times I get an answer, one of my favorite questions to ask people is, do you remember what happened just prior to the onset of your symptoms? And a lot of people will say things like, well, I went on a trip to Mexico, or we traveled, out of the country. I got sick and man, I have never been the same. Or I got COVID and I've never been the same. Um, so there is generally a trigger. Um, and many people can put it on a timeline. Other people cannot, and that's okay too. Um, so I just wanted to point that out, is that if you think in your mind, you're like, gosh, this I remember, like I used to be just fine, and now this thing happened, and all of a sudden, um, I can't seem to get anything to work right anymore. So just kind of reiterating autoimmune disease management strategies. Stress and sleep are my two favorite things, which honestly is almost like an oxymoron, because if you have health issues, you're going to feel stressed. If you have health issues and you're stressed, it's going to probably interrupt sleep. So we definitely want to have a stress management plan, and we want to help encourage better sleep habits. And we do have strategies around both of those things: diet, body movement. Body movement is big because um, the body movement or exercise, people with autoimmune disease find it difficult sometimes, especially during a flare up, to be able to get up and actually go on a walk or do something physical. Um, and then we have other people that are out running marathons. The body needs a balance with body movement. So you need to, if you have an autoimmune disease, you should be getting up and doing something, even if it's just walking. And also, even though it might feel amazing while you're doing a marathon or while you're doing HIIT training, if you have autoimmune disease, you definitely want to honor your body. You want to be listening to your body's feedback. If the next day your joints hurt, if the next day you feel really fatigued, your workout might need to be modified. And it doesn't mean it always has to be modified. With autoimmune disease, like we talked about, it ebbs and flows. And so there's going to be moments when you might have to pull back. You might have to pull back on diet. You might have to pull back on exercise. So just think about those things. Personalized supplements, I put glutathione and nitric oxide. They're two of my favorite things. Microbiome diversity. The microbiome has a huge play in autoimmune disease. And so we always run a comprehensive stool test, to be able to understand the makeup of somebody's microbiome. And every single autoimmune disease will have a very unique blueprint for every single person. My ulcerative colitis will look different than the next person's ulcerative colitis. There are certain things that will be common, but the triggers and all of the other nuances are going to probably look different. So the approach needs to be unique to the individual. So one of my favorite strategies, and it's something that anyone can do, is glutathione. And this is going to get a little sciencey, but I think it's super cool. So let's go for it. So basically, there's two types of glutathione. So first of all, glutathione is our master antioxidant. So this is basically, when I say master antioxidant, think of this powerhouse shield. So it's going to take the brunt of those pollutants, the toxins, the hormone change, the way that the body is affected by hormone changes, that exhaust that comes into the car when you're pumping gas. All of those things need glutathione to be able to attach to send out of the body. So the idea here is that we've got something called free radicals that happen. Free radicals cause cellular damage that causes inflammation. That's right there in a nutshell, something just to think about. But so glutathione comes in reduced glutathione and oxidated glutathione. Reduced glutathione, that's what takes the brunt for us. Essentially what happens, and here's the sciencey part, is that free radicals are called free radicals because they actually have an unpaired electron, and they're looking around to say, hey, somebody give me an electron, so that it's not oxidative anymore. It's not a free radical anymore. Well, glutathione actually gives free radicals an electron and makes them much more stable and less inflammatory to the body. So if we have substantial amounts or, even just, enough glutathione to be able to take on the free radicals, then that means that we're less likely to have this chronic inflammation ensue. What happens though is when reduced glutathione gives an electron away to a free radical, it becomes a free radical. And so that's when it becomes oxidated. It's oxidized glutathione. And so basically what we want to have is we want to have way more than enough glutathione in the body to be able to take on all those things, especially when we're having symptoms, right? If I'm not necessarily talking to the person that feels amazing, right? I'm talking to the people that come into the clinic and otherwise people that are having health issues. Glutathione needs to be one of the first things that you think about. And it's great to do IV, but also we have a product here that I absolutely love that actually takes that oxidized glutathione and turn it into reduced glutathione. That's really important because what we need, this particular supplement, it pushes glutathione into the cell. So it's great if we have enough glutathione that's around the body. We want glutathione to be in the cell, having a really positive impact on mitochondria. And so when we have enough glutathione, we're basically less likely to have inflammatory issues. When we become depleted, we turn on inflammatory pathways. So I say when we become depleted, that's the smoke before the fire. When we become depleted, we have a nitric oxide isomer that turns on an inflammatory pathway that's very common for people that have autoimmune disease. So there's 3 types of nitric oxide isomers. 1 is highly inflammatory and 2 are amazingly healing. And so I like to use a combination of a very specific type of nitric oxide compounds that actually help increase the 2 isomers that are really, really healthy that shut down inflammation, along with glutathione that is pushed into the cells so that we can interrupt these inflammatory pathways. So I have one more slide, I think. I just wanted to say this. This is a quote from one of my favorite people. His name's Dr. Datis Karazian. Promoting glutathione recycling helps protect cell mitochondria, enhance tissue recover, modulate an imbalance between TH and TH1 and TH2, and boost immune regulation. So that's a lot just in one sentence. He goes on to just say the overall effect is to dampen the autoimmune reaction and damage to the body tissue. It helps body tissue and the intestinal tract regenerate and recover. Keeping overall glutathione levels up by supporting glutathione recycling helps buffer the body's cells from the many stressors hurled at us each day. So TH1 and TH2 are basically 2 arms of the immune system. And when they get out of balance or get stuck in one arm versus the other and don't come back into balance, that's where we have, constant inflammation. And Megan is going to talk about another amazing strategy that we have here at the clinic called LDN. And we use this, and this is a great idea for autoimmune disease too.
Okay. I'm just making sure my microphone is on. Okay. Cecily did awesome. That was amazing, Cecily. Thank you so much for that incredible information. It was very, you took something that's very complex and presented it very nicely. And I wanted to discuss a little bit further, just you mentioned stress and how much that affects us. And we all know that, and I'm not going to go into too much on that, but just keep in mind that, we're always all going to have stressors, and we can't always take those away, but we can learn to change the way that our body responds, which can literally save our lives. And one of the biggest things that you can do is just remember to practice mindfulness and pay attention, being in the moment.
just little bits and pieces throughout the day when you wash your hands, or just little pieces. Just remember just to focus on what's going on right now and not worrying about the future or reflecting on the past. So that's my 2 cents. And she also mentioned that a lot of people are diagnosed with diseases or things, and they don't know that it's autoimmune in nature. And I was told that I had some sort of, I guess it's a disease process, many, many years ago. And I just now realized that it's probably autoimmune, and nobody ever talked to me about that. All right, so I want to talk about inflammation. These are some conditions that, the chronic conditions that are really taking control over our health. It comes down to basically inflammation for the most part. Chronic inflammatory diseases are very complex to treat. They can have a significantly negative impact on your quality of life. And as we know, the standard of care is failing miserably at these conditions. We're doing great for emergencies, but these kind of things, not so good. Inflammation can be triggered by many, many things. It's meant to be a good thing. You're supposed to be able to have inflammation, but it's not supposed to stick around for very long. So when it's excessive, it's a major contributor to many of our chronic diseases, including cancer that develop. And of course, autoimmunity is definitely on that list. There are many factors to consider when you have chronic inflammation and autoimmunity. And today I just wanted to briefly discuss one thing that can be life-changing for some people, but is rarely used. So naltrexone is a drug that was first synthesized in 1963. It was patented in 1967, approved by the FDA in 1970, and then in 1984 for opioid addiction. In 1970, they were using it to treat overdose. So if somebody overdosed on something like oxycodone, for example, they would use naltrexone to treat that overdose and reverse it. And then they realized it could be used for opioid addiction. And then in the 90s, it was used for alcohol addiction. And this type of dosing was 50 to 200 milligrams, usually about 50 to 100, but could go up to 200. And then 2005, they developed something called Contrave, which was marketed to help with weight loss. And it was a combination of naltrexone, 16 milligrams, with Wellbutrin, which is an antidepressant. And some people still use that, but it does not come without side effects, the Contrave. So we aren't talking about naltrexone in those large doses. What I want to talk to you about is the low doses. So in 1985, Dr. Bernard Behari was working as an addiction specialist in Brooklyn, New York. He was using methadone, but was offered something called an orphan drug, which was naltrexone, 50 milligrams for heroin addiction as well, also used for heroin addiction. So he started to see, while he was doing this work, he started to see a different disease that popped up and didn't have a name back then, but now we know it to be HIV and AIDS. He knew that when 50 milligrams of naltrexone was given, the disease would spread because the immune system was suppressed with naltrexone. He also discovered that his patient population had less than 20% of normal levels of endorphins, and then consequently this low level of endorphins contributed to the weakened immune system in his patients. So he started to explore and research lower doses of naltrexone, and he found dramatic improvements in lifespan and quality of life with low doses. They were getting relief from symptoms. It did take many years, but he finally discovered that taking low dose naltrexone, as he coined that term, and very well known as LDN, actually increased blood levels of endorphins by 300%, which is pretty significant. So these low doses are 1.5, typically 1.5 to 4.5 milligrams. However, that definitely depends on each person. Sometimes we have to start lower at 0.5, and sometimes we need to go higher than 4.5 to get that sweet spot for each individual person. It's not a one dose fits all. It really is very personalized for each individual. Sometimes we need to change the dose 3 to 4 times until we find the right dose. But if you tried it and you say it doesn't work, it's probably because you're just not on the right dose that's for you. Originally, the 3 milligram dosage was researched the most by Dr. Bahari, but he actually had a patient who was prescribed the 3 milligrams, but the pharmacy where she got the prescription picked it up. They were out of the 3 milligrams, so they only had 1.5s. So they gave her the 1.5, and she was supposed to take 2, but she accidentally took 3 one night. And then she called him crying the next day, and she said, "Oh my gosh, I took too much LDN." And he said, "Well, what's going on? Why are you crying?" She said, "Because I can't believe it. I can walk, and I can feel the bottom of my feet." And this was an amazing breakthrough, and it triggered him to start prescribing 4.5 milligrams, including him for himself and his wife. And he saw immense therapeutic effects with this dose. LDN can prevent autoimmunity from progressing and also can help bring the disease into remission. So how does it work? We have opiate receptors all over our body that regulate many, many functions by releasing natural opiates, which we know as endorphins. And LDN briefly blocks them, increasing natural production. So there's also these things called toll-like receptors, or TLRs, that are part of the immune system and provide a first line of defense for us, specifically TLR4, which is on the surface of many cells, gets activated when stress or damage is detected, and this activates the inflammatory immune response. So LDN, this is just more of a visual of what I just said, but like I said, we have opiate receptors all over our body. They regulate these functions by releasing the natural opiates. But what LDN does is it briefly blocks them, and this increases our natural production of endorphins. Also, balancing the Th1, Th2 system of our innate immune system. So the Th1 system sends out like artillery bombs, just bombing our invaders. Get out of here, we don't want you in here. And then whatever is left over, Th1 just goes in and they tries to clean up and finish up the destruction, the killing. When you have chronic inflammation, this Th2 overreacts and makes more of it than it really is, and it can create more and more antibodies, and this leads to autoimmunity. So what does LDN do? Well, LDN comes in and it decreases the Th2 response and says, stop you're overreacting, dude. This is not that big of a deal, just chill. So basically chills that response and helps to regulate your immune system. LDN does activate opioid receptors, but you do not get high from it. It can also lessen anxiety, and it's also known to block the reward pathway, which can work for all kinds of addicts, but also food addicts. And that's probably the big reason why they decided to put it into Contrave, is to help with that. So to get it, it is a prescription only. Please do not try to buy it online. There's no, can't speak to any safety of those. It is compounded, so it's fairly inexpensive. It is not covered by insurance, but it can be pretty amazing. So prescription only, compounding pharmacy. Please don't buy it online. LDN can help with inflammation that is associated with all of these symptoms. So fatigue, lethargy, aches and pains cancer, itchy skin, mood dysregulation. There's many, many more, but these are some of the common symptoms that we see that are related to the autoimmunity and caused by an immune system dysregulation. And Stanford has actually been using LDN in their fibromyalgia clinic for many years. But why isn't it being prescribed more, and why don't people know about this? Why does it have to be such a secret? Well, it's old and generic, and it is also inexpensive. So it's not in the PDR, which is the physician's desk reference. So if it is in the PDR, prescribers feel like they're protected and won't get sued. And if it's not, then it creates fear. However, the PDR also contains many things that are false and not evidence-based. As we know, our medical system is full of fear driven by big pharma. And there's no incentive to spend lots of money on tons of research because of these reasons. So we really need to look at what works, what the evidence says, and stop following and being brainwashed by pharmaceutical drug companies. There are some potential side effects, not very common. And if these side effects do happen, they're temporary, maybe lasting 2 to 3 weeks, and they usually subside. So there's some potential for sleep interruption. This is thought to be due to the release of endorphins, and a headache, especially if your endorphins are pretty low. When you start to increase them more and more, it can cause a headache, mild usually, some nausea. I haven't actually had anybody report that to me, but it can increase gut movement. The most common one that I hear is vivid dreams, and that doesn't usually bother most people. The only time it would really be a problem is if you're having vivid dreams that are scary and traumatic. And then you just back down on the dose and stay at that for a little while, and you can gradually increase. It does block the effects of opioids. So if you're taking something like that for pain, it's not going to really work. So the other thing is it is recommended to take it at night, because we have we produce the most natural endorphins at night, somewhere between like 2 and 4 a.m. is what they found. And so it's recommended to take it at night. But if for some people, which is very rare, but for some people, if it does cause this sleep interruption, then we can have them take it during the day. And eventually then later, we might be able to switch them back to taking it at night. So it's really a very artful practice in order to prescribe the exact dose that's needed to improve symptoms, quality of life, and longevity. So in summary, there are some potential side effects that are temporary and can be controlled with adapting the dosage. It does prevent autoimmunity from progressing, can also help bring the disease into remission so that this disease does not define you or your loved one. You're able to live happily and symptom-free with a high quality of life, especially when you make lifestyle changes and follow recommendations from Cecily. And there are way too many tragically detrimental and toxic drugs being prescribed for autoimmunity that really don't even work, or sometimes they make things worse. People feel worse, and they're oftentimes quite expensive or even just experimental. And this LDN has been around for a long time. It's got patents and a lot of history to show that it has improved quality of life and autoimmunity. It just doesn't make sense not to try it. It's something that's been working for years. It can relieve pain, reduce inflammation, balance your immune system, and even increase your dopamine, which is your reward center. You're feeling happy. So who doesn't want more dopamine and endorphins? I think I certainly could always take some more. And this is just a slide of my references. And thank you so much for listening. If you would like to connect with us, You can call 512-589-4399 or text. And there's our website. We will be posting this recording on the website as well.
And before we leave, I just wanted to say, I spoke earlier about a book that I wanted to recommend. I didn't put a slide in, but I do have the book with me. Oh, it's blurry, isn't it? Okay. Well, it's called Immune, A Journey into the Mysterious System That Keeps You Alive by Philip Detmer. And it is on our social media pages too. I made a recommendation out there for that too. It's a phenomenal book about the immune system. Unfortunately, I mean, he sums up the autoimmunity at about 5 pages, but he does it in the most brilliant, amazing way. So it's a very almost comical book to read. It is lighthearted. It is amazing. He has done a brilliant job at making learning about the immune system fun and easy. So I highly recommend this book to anybody that's curious about knowing more about the immune system.
Awesome. Thanks, Cecily. All right. Have a wonderful rest of your day.